My name is Mark Ranzinger. I'm a general surgeon here at Goshen Hospital with an emphasis on minimally invasive surgery. One of the things that impressed me in coming to Goshen was the capabilities of the hospital in terms of vascular surgery, doing very high-end complex vascular procedures, and the cardiologist, vascular surgeons work very closely together with that. The type of cancer surgeries that are performed, and the general surgeons will sometimes assist with cancer surgeons, but they're doing cases where we're at times getting referrals from Indy up here to our hospital. And the general capabilities is very broad, but also very deep. For a small town atmosphere and feel and vibe and being part of the community, to find a hospital like that, I decided that's where I wanted to come and practice. Within the Goshen Health system, I'm part of a general surgery practice with 7 general surgeons offering a variety of vascular, bariatric, and general services. General surgery has an appeal to me because patients have usually some form of pain or discomfort, and to be able to take a patient from the distress they're feeling, prepare them for surgery, get them through surgery, and see them afterward feeling much better, being restored to the health they used to enjoy, is a wonderful experience. For almost a century, general surgery was known for the big incisions they left on people. And over the last 20 or 30 years, this new area, minimally invasive surgery, where you can do very complex surgeries within the body with very minimal incisions, usually an inch or so. And the advantage of that for a patient is less postoperative pain, less scarring, much faster return to work or normal activities. And for all those reasons, I'm very happy to offer minimally invasive surgery to my patients. In our practice, we see patients from about 5 years old or so all the way up to well into their 90s and take care of the routine general surgery problems that are seen across that spectrum of life, which would include appendiceal problems, acute appendicitis, gallbladder disease, bowel obstructions, thyroid problems, parathyroid problems, abscesses, and hemorrhoids. We always appreciate workups that are either completely done or partially done, but we're just as happy to see patients who a practitioner recognizes a certain problem and said, well, you're just going to need to see a surgeon. So it's no bother to us at all if somebody comes not being worked up. Just if you recognize there's a general surgery problem, we're happy to take it from there. In our practice, nurse practitioners play a very supportive role in helping care for our patients. Almost always the physician will be the initial point of contact with the patient, but they do a wonderful job of helping us both in surgery, with hospital rounds, and office patients. And I think they really complement the physicians because they often can take more time with greater explanations for the patients. In terms of cardiac, vascular, general surgery, cancer surgery, we're far beyond what you'd expect from your typical small community hospital.